The current role of LithoClast in Western Europe is basically three indications. First, bladder stones. Larger calculi in the bladder can be destroyed with the LithoClast. The second most indication is rigid ureteroscopy and fragmentation of larger, basically impacted stone with a rigid probe. And the main indication, and the most patients come for percutaneous stone surgery, either with the LithoClast master, the combination of ultrasonic probe together with the LithoClast probe, the pneumatic ballistic principle, or with a mini perc where you can either use the LithoClast probe or the ultrasonic probe alone. The strength of the LithoClast in PCNL and mini PCNL is that on one side the instrument is a very reliable and durable instrument. It's relatively inexpensive to purchase for the hospitals, and it's a cool invention. For the destruction of the stones, you can either use two different methods. One method is the LithoClast probe for fragmentation with the pneumatic ballistic principle, and this can fragment even the hardest stones like calcium oxalate monohydrate stones. On the other hand, you have the combination of the LithoClast master, the combination between an ultrasonic probe and the LithoClast probe, which can destroy hard stones and in the same time suck off particles through the LithoClast probe, through the ultrasonic probe, out of the renal pelvis. The video shows calcium oxalate monohydrate in the renal pelvis. This is treated with a mini perc and the LithoClast probe alone. The stone is very hard and very hard to target because it moves around in the renal pelvis. The trick in fragmenting the stone is that you have to press it a little bit against the wall of the renal pelvis and then activate the LithoClast probe. You can also see that the LithoClast probe is sometimes activated next to the stone, not to press too much on the stone and propagate the shock wave from the LithoClast to the stone. Here you see a calcium oxalate monohydrate in dehydrate stone. This is fragmented with the LithoClast combination. The combination consists of the LithoClast probe in the lumen of the ultrasonic probe. Both are activated simultaneously. The LithoClast probe breaks the harder parts of the stone into bigger fragments, and at the same time the stone is fragmented with the ultrasonic probe and sucked off through the inner lumen of this probe. You see that the stone is fragmented from the side, not to break it up into two big particles which are harder to take out of the renal pelvis. Fragmentation is very effective, and the clearance of the stones out of the renal pelvis is done simultaneously. This shows a mini perc of a combination stone of monohydrate in dehydrate. This is also quite a hard stone, which is only fragmented with the ultrasonic probe, and this is just done by pushing onto the stone and pressing it a little bit against the back wall of the renal pelvis. The stone readily breaks under the sonotrode into a little bit bigger parts, which can be taken out with forceps through the mini perc. It has to be taken care not to irrigate too much so that the stone particles don't move too far away from the scope, otherwise you have to follow them to the upper calyx. The fragmentation is very effective with the ultrasonic probe alone, and you see bigger particles which are further followed to the renal pelvis and to the upper calyx and fragmented further. This is a dihydrate stone, a crystalline stone. This is fragmented through a mini perc with the ultrasonic probe to get bigger particles at first and take the fragmented particles through the lumen out immediately. Later on, you will see that we use a laser to fragment even smaller particles and dust the stone, which can be sucked out through the ultrasonic probe. Both methods are also very effective in first having a little bit bigger fragments with the sonotrode, and later on using the laser to fragment it into smaller pieces. The laser is applied to the stone in the middle of the stone, just to fragment it first into a little bit bigger particles, and then to go after these to have smaller fragments. One can also apply the laser to the edges of the stone and try to chip off small particles from the stone, but this is sometimes difficult and the stone may move around a little bit. In the renal pelvis, it's standard of care to have the LithoClast master because it can destroy the stone, and through the ultrasonic probe, softer stones can be destroyed and sucked through the probe out of the renal pelvis. The stone free rates are very high using the LithoClast in the upper urinary tract. They go up to 90% stone free rate in our patient population, and the destruction and fragmentation rate of the stones are close to 100%.